Well, thank you all for being here this evening. Appreciate wonderful turnout. It's good to have that for sure. This is our 2004 annual public meeting for the Borough of Staten Island. Before we start, I just want to make everyone aware there are translation services available for Spanish. 212-788-3359. If anyone does need Spanish translation, again, 212-788-3359. I'm Dr. Vincent Calamia. I am the Staten Island City Council representative for the Board of Directors. And again, I want to thank all of you for coming in this crazy hot day today, making it to Seaview. I do want to introduce the other members of the board who are here this evening. My right, Brooklyn representative, Sally Hernandez, and our vice chair, Rita Rang, and our president and CEO, Jill Katz, board members. And Andrea, our counsel, will introduce herself shortly to go over the ground rules, and then Calicia Hercules, who's our secretary for the corporation. So again, I'd like to extend our thanks, acknowledge the wonderful leadership of CU, Matt Levy, who's here, and magnificent work has been done here, and very proud of CU here. Harry Harewood is here as well, regional administrator of Vanderbilt. Of course, all the dedicated staff of CU. As you know, we strive to support best we can equal access to safe, affordable, quality care here on Staten Island. And with that, again, thank you so much for being here, and I'll turn over to CEO Schatz.
Good evening, everybody. I'm so proud to be the president and CEO of New York City Health and Hospitals, which is an amazing organization full of compassionate people delivering the very best of care. We have about 9,000 nurses, 4,000 providers, social workers, environmental service workers, and a large group of people really committed to serving New Yorkers high quality care. I want to thank those members of our staff who are here today and our board, and especially all of you for coming out. The whole purpose of these community meetings is to hear from people and to learn from your experiences and to benefit the community as a whole. Before we begin, I want to highlight some of the major achievements in the last year since we had a hearing in Staten Island. We opened up a new hospital, the Ruth Bader Ginsburg Hospital on the campus of South Brooklyn. If you haven't been there, go by. Large statue of Ruth Bader Ginsburg in the lobby. Our nurses were able to gain parity with private hospitals, which has enabled us to now hire 1,300 new nurses so that we're going to not have to use nurse registry any longer. We have been in the forefront of caring for the asylum seekers at our arrival center, making sure people are vaccinated, that the kids have school to go to, that people have food and shelter. We opened up a re-entry service at Rikers Island. We have a lifestyle medicine clinic in every borough, including at Vanderbilt. We serve plant-based meals as the primary choice for dinner at our hospitals. New York City Care, which is our program for people who cannot afford or are not eligible for health insurance, hit a milestone of 125,000 members. Over 500 patients of ours found permanent housing through our Housing for Health team. We have advocated for $95 million in through medical equipment and structural upgrades. We have opened 9 murals in our facilities. We have converted medical units that we used in COVID back to their original purpose for psychiatric care. We've provided debt relief to behavioral health providers in exchange for their agreeing to work for us for a prolonged period of time. We offer telehealth medication abortion services through our virtual express care. We have expanded our services for survivors of domestic violence. We're using the Da Vinci robots throughout our system. And then specific to Staten Island, of course, with Matt Levy and his staff, we're so proud of Seaview, which is rated as the #1 nursing home in the entire state of New York. Pretty amazing, you know, for people who doubt whether the public sector can work. Pretty amazing that this is not #1 among the public facilities, but #1 among all facilities, public and private. And you have some close competition because 3 of our other skilled nursing facilities ranked in the top 10. And just give people a sense, there are 600 nursing homes in the state of New York. So we are better here at Seaview than 599 nursing homes. It's pretty amazing, pretty amazing. You are a 5-star center. You have a new Parkinson's care certification unit. And then we're also very pleased with Vanderbilt, which now has opened up a buprenorphine clinic. They have their lifestyle medicine, a full-time women's health provider. The pediatrics program has a state-of-the-art reach out and read for the children, and it received the LGBTQ plus healthcare equity. So it has been a good year for health and hospitals. We're very proud of the people who work for us, and we look forward to hearing your comments and recommendations during the next session. So with that, I'll turn it over to our general counsel.
Thank you so much. My name is Andy Cohen. I'm the general counsel at New York City Health and Hospitals, and I'm going to be your moderator for the rest of the evening. This is the 5th in a series of 5 meetings that Health and Hospitals conducts annually across the city's 5 boroughs. The purpose of these meetings, as Dr. Katz described, is to inform the public and you on programs and plans of New York City Health and Hospitals, which Dr. Katz just did. And now we are affording the public an opportunity to present oral testimony and also to submit written testimony if you'd like about New York City Health and Hospitals programs and its performance. All testimony that we hear tonight or anything that is submitted tonight or tomorrow will be either transcribed if it was oral, or just submitted to all of the members of New York City Health and Hospitals Board of Directors, although you have a wonderful showing of members of our Board of Directors here this evening to hear it live as well. We have registrations open to speak for another 2 minutes. So if anybody in here wasn't sure, you have another 2 minutes to register to speak this evening. If not, we have a list of about 23 folks today. So just to give you an idea of our numbers. Let me give you a quick, some highlights on the rules of the road for testimony, giving testimony for the rest of the evening. So the first thing to understand is that the members of the Board of Directors are here to listen to you at this point, to listen to what you have to say, but not to engage in a dialogue or a back and forth or a Q&A. So this is an opportunity for us to just listen to you, the speakers. Each speaker is allotted 5 minutes. That's obviously so we can get in as many people as who want to speak as possible. And keeping to that time frame is very important. On the podium right in front of me is a timer that will provide you, the speaker, with an indication of your time. It will be green when you begin. A yellow light indicates that you have 2 minutes left in your speaking time, and a red light means obviously that your speaking time is expired, and after a few seconds it will start to blink, and that's when I will, if I need to, gently interrupt you and ask you to please finish your sentence, and we'll take anything else that you have to say in writing, even tomorrow. And you could submit anything that you want in writing to Calicia Hercules, the Secretary of New York City Health and Hospitals Corporation, who is next to me. All of your testimony will go to all of the members of our Board of Directors. I will be calling on speakers with the name, title, and affiliation that the speaker provided when they registered. I'll announce the next speaker, and then I will also, when I hope I will remember every time, give you the name of the next person who's going to be up, the sort of on-deck speaker, so that you can be prepared and know that you are coming after the current speaker. If I mispronounce your name, please begin your statement by saying it the right way, and I apologize in advance. I'm doing my best. But please let us know the proper way to say your name if I get it wrong. Thank you so much, and we will now hear from the first presenter, who is... Oh, okay. And if anybody has come in who needs translation services, you can call this phone number and they can translate in Spanish, 212-788-3359. Or, okay. Or you can go to the registration desk and they'll connect you to a Spanish interpreter as well. Yes, thank you. Yes, okay. So our first speaker is Lisa Mattel, I hope I pronounced that right, from the Staten Island District Attorney's Office. No statement. Okay. All right. Then our next speaker is Fatu Masali, President of the Staten Island Immigrants Council, and after that is Joseph Sicilian. So I think it is Fatu Masali. Did I get that right? Okay. Thank you.
Good evening, everyone.
Good evening.
Good evening.
So by way of introduction, my name is Fatu Masali. I'm actually proxying for Abu, who is the president for the Staten Island Immigrant Council, but I am the vice president of the Staten Island Liberian community. So to add my voice to the valuable cause while we're here, to speak on the show van, right, within Staten Island. As we know, Staten Island, being one of the boroughs, seems to be the forgotten borough. And as we speak right now, the 4 other boroughs have full-time show vans, and Staten Island usually only have it part-time. So it's so important that we understand the crucial need of this show van. There are many of us that live within Staten Island that's on the shore, doesn't have insurance, and we depend on this van, the services that the van provides. So just understanding that, being the only borough in Staten Island without the full H&H services, thousands of Staten Islanders have to travel out of Staten Island just to see specialists. And we're talking about low incomers, right? Funding may also be an issue. So we want to make sure Staten Island have all the services that we can maintain within Staten Island for us all to benefit from. The van is truly a lifeline and a lifesaver. I grew up on Park Hill and Stapleton area. Sometimes the van is there, and just seeing the van being able to test for hepatitis B. We all know the impact of hepatitis B, hepatitis C. We already know what happened during COVID. Many of the Staten Islanders that live within that area were able to benefit from the services the van provides. So it's so crucial and important that you hear what we have to say and listen to us, because we are the one living. We are the one living in Staten Island and going through the crisis that we're going through. And the show van is so very important to us. So please, whoever we can speak to, whoever we can call, please let us know. And we have to knock their door to let them know how important the show van is to be maintained in Staten Island and increase our budget. It's so unfair to Staten Island. Every other boroughs, they have a full-time line for the show van. And we have to share the show van with another budget in Staten Island. It's so very important that we have a separate budget for that, so that our people, someone like me, our color, minorities, anyone can benefit from the Chauvin. So thank you for your time, and please listen to us and take back the news, because Staten Islanders, we're ready. Thank you.
Thank you.
Thank you for your comment. The next speaker is Joseph Sicilian, a board member for Project Hospitality, and after that will be Arunima Mamidi.
First of all, thank you for coming and welcome to Staten Island. If you look out that window, you'll see a building covered in trees and vines, part of the original Seaview Hospital, where diseases were cured, tuberculosis, unbelievable things. So how did the trees and vines grow over the building? Very simple. Neglect. We are neglected in Staten Island. There is no other way to put it. We don't have our own hospital. The Chauvin, even this impassioned plea, short-sold it. It was much more vital than this articulate speaker said. I, as a board member, give out food from our bands. I love the job. I spent 44 years in the classroom and loved every minute of it. But this is even better. Our people are ill and well. They are grateful and angry. They are real people. We need the Chauvin. End of the discussion. We need maybe to come out here with a couple of axes and chainsaws and maybe cut away some of that growth and reestablish it as the health center it was. 25, 30 years ago, when I first came up here, it was a scary place. It really was. But slowly but surely, health and hospitals, other people took it back. They took it back because they wanted to keep the services here. And I ask you, board members, please stop neglecting Staten Island. We need help now. Thank you for your time.
Thank you for your comments. The next speaker is Arunima Mamidi, a physician with the Aisha Foundation. And after that is Aisha Pathak, also from the Aisha Foundation. Okay, go ahead. Just one speaker from Aisha Foundation. Great, thank you.
Good evening, everyone.
Good
Can everybody hear me?
Yeah.
Okay, great. My name is Dr. Isha Pathak, and I'm a board-certified internist and a hospice palliative care physician, practicing in USA for 30 years now. Why I'm here today? Did you know that number of suicide deaths in USA in 2023 alone exceeded 50,000? And this does not include attempted suicides. It's not just a number. 50,000 families are scarred forever. Surgeon General has declared it as a defining health crisis in our times. I wish to talk about a program called Inner Engineering as a volunteer of Isha Foundation, founded by Sadhguru Jagdish Vasudev, a yogi, mystic, and visionary, who has dedicated his life to human well-being, and all his endeavors are geared to uplift humanity in every aspect. Inner Engineering program is designed by Sadhguru, involves powerful practice, Shambhavi Mahamudra, which is a distilled essence of ancient yogic sciences. To say in one line, I feel everybody should do this program and it should be a part of school curriculum. Doing this I can say comfortably that eradicate mental health problem. Why do I say so? I'm going to talk about inner engineering and research data on yoga and meditation in achieving inner balance. What is inner engineering? Engineering the self. It's a technology derived from science of yoga. It's a comprehensive course for personal growth and improves and helps you to create life the way you want. Bring health, joy, bliss, and cognitive reappraisal. It's a multi-component technique which are highly recommended by National Center of Complementary and Integrative Health. Coordination between breathing and body habits leads to vagus nerve stimulation, which benefits gaining mastery over your emotions and bringing joy. I want to talk about Sadhguru Center for Conscious Planet at Harvard Medical School. The lab explores neurosciences behind the classical yoga. Wellness programs are geared towards long COVID, cancer survivors, and mental health in Parkinson's disease. I personally know of several physicians and institutions who have adopted this and improved their patient satisfaction scores and happiness of the patient and health. Large population studies have been conducted with results of subjective and objective data, including blood markers, neural imaging, and gene expressions. 6 weeks of inner engineering practice in IT professionals showed 50% reduction in perceived stress and decreased negative thoughts, improved sleep quality, improved relationships, and well-being. Study of Fortune 500 participants revealed enhanced joy, vitality, work engagement, enhanced memory, and relaxed alertness, focus, creativity, problem solving. And I am a double board certified physician who experienced burnout down the road in my profession. And this program came to me as a life-changing blessing for me, and that's the reason I'm standing here today and advocating for that. I have gained enormous amount of clarity in my life. I did this program 20 years ago. I'm able to resolve my conflicts quickly, and my life has improved in all spheres: physical, mental, social, emotional, professional, relations, whatever you say. And in a nutshell, this is my second life, so I recommend this program to everybody. And let's have a joyful life and journey and engineer ourselves. Thank you.
Thank you. The next speaker is the Reverend Terry Troya, President of Project Hospitality, and after that is J.C. Robinson.
My great thanks to Health and Hospitals for all they've tried to do on Staten Island and have accomplished on Staten Island. We still need to recognize that Staten Island, with a burgeoning immigrant community that doesn't always, and most times does not qualify for public insurance, is really left struggling to take care of their medical needs. And within hospital in Staten Island, it's very difficult for people to get the care that they need. I think I want to speak clearly that while we have perhaps we have enough beds, I'm not sure, I heard you say that, Dr. Katz, at the last public meeting on the South Shore. What people don't really understand is in a private hospital, while some of your coverage may be taken care of by charity care, your hospital doctor bills get billed to you. So someone that goes to the emergency room at Rumsey or SIUH may walk away with a $25,000 or $40,000 doctor's bill after their care. That knocks out any chance for them to have any kind of credit that then affects their ability to rent an apartment, and it sets people back. So people don't go to the hospital when they need to go to the hospital. And I'm going to give you an example. I received a phone call a couple of years ago from someone I didn't know living in the Clifton area of Staten Island, whose husband at 40 years old was bleeding rectally. And she was afraid to call the ambulance because she already had 2 $800 ambulance bills. And so we sent a cab from Project Hospitality to take them to the emergency room. This man had been in the emergency room 3 times in Staten Island, overnight and then sent home, overnight and then sent home. In the end, he was diagnosed with late-stage colon cancer. But over a 3-month period of visiting the emergency room, no one caught it. And they were afraid to pursue the medical care for fear of the bills. And we attended his funeral at Our Lady of Good Counsel Church. It should not have happened, and people die like that. People are afraid to go to the hospital because of the bills. That's why we need some kind of a health and hospitals facility on Staten Island, and I know that there was an effort to try very hard with Rumsey, and I don't know how to solve the problem, but you need to understand that it's very hard for people to get the care, and it's very hard for people to get to Bellevue when they have a traumatic injury. So we really need to pay attention to how we're going to solve this. We are the only borough without a city hospital. We're the only borough without a Health and Hospitals pharmacy. Health and Hospitals opened the new Gotham Vanderbilt in 2017, but Stapleton closed. And then 3 years later, Mariners Harbor closed. And that makes it very hard for people on the other side, on the west shore of Staten Island, to be able to get all the way over to the east side of Staten Island in order to get care. We used to have a mobile clinic 5 days a week, and that closed. And now we have the Chauvin, which is 1 day a week. So while new services are wonderful, we cut back on the hours, we cut back on the days, and we need to look at what are the overall comprehensive needs of people who don't have insurance on Staten Island. I ask that you help find a way to keep the Chauvin in the city budget. And we understand that it's an OMB issue, it's not a health and hospitals issue. The Chauvin seems to be very easy to solve. Remove the money of the Chauvin for Staten Island from the subway outreach program. Speak with our deputy mayor, Isom, and see if that can be pulled out and put into a separate posting for OMB. Or take 1 day a week from the other boroughs who have full-time Chauvins and give that day to Staten Island. Or more so, give us a van 5 days a week. Because what the van does is, it's low threshold and it lets people come into the van for whatever the issue is and then connects them to care. And in a few minutes, you'll hear some of the life-saving stories that that van has accomplished by its presence on our street. It is a matter of equity for Staten Island. It is not just a matter of dollars. How can 4 boroughs get this and we who have next to nothing on Staten Island lose our Chauvin because of a problem inside the budget? Thank you very much for your creativity to find a solution to keep the Chauvin here.
Thanks for your comments. The next speaker, thank you. The next speaker is J.C. Robinson, first vice president, and after that is Joseph Conti. J.C. Robinson, did I pronounce it correctly? J-A-S-I, yes? Okay. Joseph Conti.
And better looking, tell him I said that. So I'm reading, my name is Jody Stoll. I'm from St. Mary's Episcopal Church, and I'm reading for my friend, Dr. Joseph Conti. Joseph is from the Staten Island Performing Provider System, and he addresses this to Deputy Mayor William Isom and Dr. Katz. Staten Islanders experience amongst the highest rates of cardiovascular disease, hypertension, diabetes, breast, lung, and prostate cancer of any borough. The Black and Brown community on Staten Island had amongst the highest early death rates from COVID. There is no H&H hospital, and the Gotham Center remains a fledgling facility. The outreach to those citizens suffering from the greatest health inequities have been met by health and hospitals. And the Chauvin ban. The homeless, unstably housed, and immigrant communities rely on this direct access, and many times, sometimes for the very first time, receiving health care, without stigma or cost or months of waiting. That is what will be lost, not to mention the lives that will be lost if this devastating cut is not reversed. These cuts are the essence of health inequity. They will result in significant morbidity, mortality, and costs that are avoidable. Signed by Dr. Joseph Conti.
Thank you.
Thank you for your comments. The next speaker is Ashley Owen, Behavioral Health Manager for the Staten Island Partnership for Community Wellness. And after that is Karen Pershing. Ashley Owen.
Hi, good evening, everybody. Thank you for providing this forum for us to speak. My name is Ashley Owen. I'm the Behavioral Health Manager of Staten Island Partnership for Community Wellness. We are a small community-based organization that works with many of the partners who are here today on the front lines doing this important work that's part of the Chauvin and beyond. And we are here, the purpose of our organization is to really look with a public health lens on what are the health disparities going on Staten Island. And how can we interact with the different systems involved to improve it and eliminate disparities? And Reverend Troy, I did touch on this, but we just wanted to emphasize that this is a health equity issue. Right? This is a health equity issue. And by this, I apologize, I mean the show van. The show van serves populations who, if you look at the data, have very significant disparities in terms of their ability to receive care, even with the show van. So if this gets taken away, we're really going backwards in terms of establishing more health equity in New York City. Many of the people in this room, would be directly impacted, if these services were taken away. So we just wanted to have a presence at this meeting, and my executive director, Adrian Abadi, was hoping to be here but could not. But we, on behalf of Adrian, myself, and the rest of the organization, we are standing here in solidarity and in support with our partners and our community members who are on the front line to really express the importance of this. And we know that NYC Health and Hospitals, we know you care about health equity, just like we do. And we just wanted to emphasize how much of a step backwards that would be in terms of moving toward equity for our community if these resources were gone. So thank you for allowing us the time to share our feedback.
Thank you.
Thank you for your comments. Next speaker is Karen Fershing, Director of Community Initiatives at Project Hospitality. And after that is Jackie Stoll.
Good evening. This letter is written by Reverend Karen Persian. Project Hospitality's health center staff enroll on average 100 Staten Islanders in the New York City Care and Emergency Medicaid program every month. New York City Health and Hospitals locations and New York City Care program are a lifeline to Staten Islanders who cannot access Medicaid, plans through Marketplace or private insurance. We are so grateful options exist for these community members to not only access emergency Medicare and no one out-of-pocket costs, but preventive care, specialty, and primary health care are needed. However, the lack of H&H locations on Staten Island does create very real barriers to accessing healthcare services, which we would like to use this public meeting to share. Because there is no H&H hospital on Staten Islanders, our clients in need of services can only access an H&H hospital, must travel outside of the borough, often to Bellevue or Coney Island Hospital. Lack of access and transportation, the consequences of taking a day off from work, finding childcare, other fears, and Staten Islanders accessing the hospital services they need. Sometimes these clients go to Staten Island University or to Rumsey, have a difficult time navigating the sliding scale payment options. Medicaid has not deemed enough of an emergency to save life or limb. These clients often come to our health centers with large bills that they don't know how to pay. Even when a client has a healthcare need that can be addressed at HH Gotham or the Vanderbilt Clinic, when they call for an appointment, it's often 3+ months wait list. This clinic is also difficult to access by public transportation. A large portion of the New York City Care enrollees live in the neighborhoods of Port Richmond and Mariners Harbor. Yet, ever since the Mariners Harbor Clinic was closed, these residents must travel for more than an hour on multiple buses to get to the Vanderbilt location. While there are other wonderful FQHCs in Port Richmond, the sliding scale fees of these locations are often a real barrier to our clients to receive the care that they need. These health access barriers are creating a real problem and real health equity disparities. Uninsured Port Richmond residents suffer from untreated hypertension, prediabetes or diabetes at much higher rates of heart disease as the rest of the city. Parents of young children die prematurely from preventable conditions that could have been addressed with better access to care. The need for affordable dental care in our community is urgent, and we're eager for the new dental clinic in Vanderbilt to open soon. Currently, clients with dental emergency must travel to South Brooklyn for care. Many families and children are not receiving any routine dental care at all. When the HH show van started coming to Staten Island on a weekly basis at key locations recommended by Project Hospitality staff, this provided crucial access to street homeless and unstably housed clients. Our staff would often provide crowd control at these locations of the show van as dozens of people were lined up early in the day for a chance to be seen. Often there would be too many people to be seen on one day, and people had to wait for hours, had to be turned away. When the subway outreach line was cut from FY25 city budget, this had the unintended consequence of defunding the New York Staten Island show van, at this crucial mobile healthcare service for our most vulnerable impoverished residents. While the show van schedule will remain in the boroughs of New York City, Staten Island is losing the van entirely, despite being the only borough without an HH hospital. We are actively reaching out to elected officials to express the importance of getting this budget line restored for the health of Staten Island community. It is crucial that a mobile health unit fills the gap left by the show van in the Port Richmond community. Sincerely, the Reverend Karen Persian. Thank you.
Thank you.
You. The next speaker is Jackie Stoll, Executive Director of Project Hospitality, and after that is Edna Aurelis.
Hi, good evening.
Good evening.
I don't think I'm going to tell you anything that you haven't heard yet, but I appreciate you listening and hearing us out today. But as you mentioned, I'm Jackie Stoll. I'm the Executive Director of Project Hospitality. I'm also born and raised on the North Shore of Staten Island. I was very thankful and blessed that I had good health insurance. I was able to access Staten Island University Hospital, or RUMC, when I needed care, when I needed emergency care, when I needed surgery, when I needed specialty care. I gave birth in RUMC 15 years ago. My twins were kept in the NICU there. Those bills would be outstanding, would be enough to put me into debt for the rest of my life. But I was lucky that I didn't have to have that problem. When I came to Project Hospitality 12 years ago, I realized that many of my neighbors were not afforded the same ability, the same opportunity to access quality care in their neighborhood, even within a reasonable distance of their neighborhood. Staten Island has always received less in terms of health care for the poor. Every day at PH, we hear the heartbreaking stories of our clients not being able to access the care that they need. The show van has been a lifeline, but even that, it's not enough. Those experiencing homelessness and poverty, it's not just a lack of housing or a lack of money, it's a lack of stability, safety, and a sense of connection. People experiencing homelessness and poverty are less likely to access the care that they need, as Zulma just talked about. They have been provided that safety and connection by the show van. Clients know that they can trust the medical professionals as they've built relationships with those on the van. They've built relationships and trust the staff at the CBOs like Project Hospitality who have connected them to this care. They feel safe. They know that their needs are going to be met. We cannot take that away. If you had the experience of traveling on Staten Island today, you realize the traffic and you realize how long it takes to get from place to place. So Mariners Harbor to Vanderbilt is an hour on a good day, right? And Mariners Harbor to Coney Island Hospital without a vehicle, you're going to need, you're going to need to leave at early morning hours, right? It's inaccessible. It's not fair, honestly. And it needs, the very least is please, please, please do whatever you can to figure out how we can work with OMB. I know the city is trying. I know you're trying. We're very grateful for our relationship and that you lean on Project Hospitality and that we're able to have that relationship. But please, 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 this is a vital resource for Staten Island. Please don't take it away. Thank you.
Thank you.
Thanks for your comments. The next speaker is Edna Aurelis, doctor with Wagner College, and after that is Karen Contreras.
Thank you. Hi, everyone. I don't have to repeat everything that everyone has said. I'm a psychiatric nurse practitioner and I'm a family nurse practitioner. That means I do primary care, prevention, and psychiatric mental health can also be primary care or prevention. I feel like the Chauvin does all level of care, primary prevention, secondary prevention, and tertiary prevention. We need the Chauvin for Project Hospitality. From Wagner College, I collaborate with Dr. Troya, and we help many people We help clients with low economic status. We help the immigrant. I myself am an immigrant, and I know many immigrants who has no idea where to look for help. And the show van actually is like a map for them. When they go to the show van, there's a nurse there, there's a doctor there. They send them to different places where they can go. Sometimes they have to go straight to the ER before it's too late. So we know the healthcare system. We know there's like scarcity in the healthcare system, but I feel like from Haiti straight to here, Staten Island has been really a little bit forgotten borough. So as a foreigner, I know that sometimes Staten Island get the low cost, low recognition. So please, during your meeting, please put Staten Island, because we do have people who need help, and we do have people who, if they get the help and they are healthy, they can be very resourceful to the borough or to the society. So please don't forget us.
Thank you.
Thank you for your comments. Next speaker is Karen Contreras, nursing professor at the College of Staten Island, and after that is Zulma Cruz.
Good evening, all. I am Dr. Karen Arca Contreras, an associate professor of nursing and deputy chairperson at the College of Staten Island. I am also the daughter of immigrants. The potential elimination of the health and hospital show van would be a significant blow to the underserved Staten Island community. This mobile health van has been a beacon of hope, increasing access to much needed preventative and primary care for low-wage workers who are ineligible for public health insurance. The show van comes to Port Richmond Avenue, which is the hub to where immigrants work and shop. The van is a pathway to healthcare, both physical and mental. It has narrowed the gap in health disparities, and the dedicated staff, including nurse practitioners, mental health specialists, and substance abuse specialists, have been instrumental in improving health outcomes and decreasing mortality and morbidity in our vulnerable populations. Immigrants' healthcare needs must be addressed. Vulnerable populations need to be treated with compassion and humanity. I strongly urge HHC not to eliminate the mobile health van, but to reinstate it and increase it to full-time status. There must be equity among the New York City boroughs. Thank you for listening.
Thank you.
Thank you. Next speaker is Zelma Cruz, Director of Food Advocacy at Project Hospitality, and after that is Nellie Soto.
Good evening. My name is Zulma Cruz. I'm the Director of Food Advocacy for Project Hospitality, and I provide support to 2 community health centers, one in Stapleton and one in the Port Richmond section of Staten Island. On average, we serve about 7,000 households a year, so it's a lot of people. Most of the clients that we serve are either underinsured or uninsured. A lot of them are immigrant families. When I heard about the show van not being in front of our health center, quite frankly, I went through I'm a very passionate person. I'm Latina. So I went through all the emotions you could think of, from anger to disappointment to heartbreak. We not only refer clients to the show van, we actually walk them over. We make sure that we are there with them to sort of hand them over to the very professional and caring and compassionate staff from the show van. We do appreciate that they understand the sensitivities of a community that is often afraid and very poor and frail. Clients there receive vaccines, health and mental screenings, wound care. We have a lot of seniors with diabetes, often with a lot of wounds that need to be taken care of. And the professional and friendly staff do much more than just take care of the clients. They are a friendly face, and that means a lot to us. The fact that Staten Island doesn't have a public hospital is really a shame. It leaves a big portion of the population, especially most of the clients that we serve, we having to make that long trek, 2.5 hours to Coney Island or to Bellevue. Oftentimes, they don't even have the money for the Metro card, so we provide that for them as well. I have spoken to many of our clients who, especially seniors, who have to make that trek on an empty stomach to get taken care of, spend 7 hours between the travel back and forth without eating a single thing. Many of them are diabetics. By the time they come back, they pass by the health center, they look like ghosts. It is really the sad face of a poor, uninsured person. Yes, I know that we have the Gotham Clinic, and they do a wonderful job, but it's unacceptable to have appointments 3 to 4 months later when your wound is like, doing its thing. I don't want to be gaudy. So I'm imploring the city, and I really do thank you guys because I know you really care, otherwise you wouldn't be here. But I'm imploring the city to really reconsider bringing us the show van. Like Terry said, take a little bit of everybody's budget, really is math, and bring us the show van because it's really needed. And while you are talking to the people that are holding the money back, tell them that Park Hill, West Brighton, Mariners Harbor, and Arlington are also in need. Thank you.
Thank you. Next speaker is Nellie Socho, health educator at Project Hospitality. And after that is Dulce Chuva.
Hi, good evening, everyone. My name is Nayeli Soto. I work as a health coach for Project Hospitality. I've been there for almost 10 years. I also grew up, and I'm still part of the Poor Richmond community. And I have witnessed the needs in my community. And I assist uninsured families to access the medical care. It is sad and upsetting that we have to send family members to another borough to seek medical care. I have seen patients with broken bones unable to access a specialist due to lack of insurance. I have seen families in need of medical care unable to afford medication because they have no insurance and unable to afford the medication. These family members prefer not to have their medication than lose a day of work and provide food for their families. They ultimately end up in the emergency room due to uncontrolled diabetes and hypertension that are two of the main chronic conditions that are more prevalent in our community. We have no city hospital, and our city also closed the Mariners Harbor Clinic. We only have the Vanderbilt, as we know, the Vanderbilt Clinic, and that's very far to commute. A lot of our patients rely on public transportation. We have asked our HSC representatives to provide us at least with a mobile clinic, but as now they have provided us with the show van. The show van is a great resource for our community that has helped many homeless individuals that live in our parks and streets. And they're only seeking for medical care when they need. The show van has also provided wound care medications, free vaccines like flu, COVID, tetanus. It is devastating to hear that our medical resources for our most needed community members are taken away. Our community member deserves to have medical care. We need our clinic back. We need care for our families, our community. Thank you.
Thanks for your comments. The next speaker is Dulce Chuva, social worker. And after that is Maria Guadalupe Ramos.
Hi, good evening. I'd like to start by just saying thank you. It's very easy, from this end to say what we're missing, but I also like to point out that for the clients I work with day in and day out, most of which are undocumented, homeless, and with a substance use disorder, for them, it means the world to have a van, near the neighborhood that they live in. So I just want to say thank you, first of all, for everything that you guys have been able to provide for them. With that said, it's not enough. Frankly speaking, oftentimes sitting with them as they come in through our doors, I do a lot of their case management. I connect them to care. I try to start from the smallest thing, which is just a meal. Some of them haven't had food that day, to connecting them to the Gotham Clinic. Oftentimes, it's just really hard to bridge them to care. They are fearful. They're scared. They're overwhelmed. They're just trying to get through their day. And that's very hard to be aware of. That's very hard to even think because a lot of us are privileged. We're very privileged. Me being one of the privileged individuals here, right? I have a safe and cozy home. I have a family that loves me. I have food on my table. I have access to health care. I can choose which hospital I go to get my care from. They don't have that. They don't have any of that. And so for me, it's very important to point out how important it is for them to be able to keep this van in our communities, to keep this van so that they're able to not have to sit tomorrow morning and decide, do I spend the only $5 I have in my pocket on food, or do I spend it on the bus, the 2 buses that it's going to take me to get to the clinic today? Those are hard decisions that many of us don't usually have to make, and we forget that. We forget the basics. So I implore on behalf of my clients to please go back, speak with them, share with them the stories of those clients that are all the way at the bottom and can't advocate for themselves. We're limited in terms of what we can do, but we do hope that you will carry those voices. All we can do is just share their experience, share their difficulties, their barriers, and hope that you can take this back to the people who have the money and share and advocate and just let them understand and see that there are people every day that have a lot of struggles, who have to face life-changing decisions, right? Whether or not they're going to eat, whether or not they're going to go take care of the wound they have on their head because they've been carrying it for days after living under an overpass in our neighborhood. And for fear of not going, they fear going to a hospital. They don't trust the people there. They trust us. They trust our knowledge. They trust we know. And if we know the people on that van and we can walk them, which has been the occasion, we have walked them to those vans and tell them we trust them, therefore you can trust them, then they're more willing to access those services. And I've had to do that with the clinic. It's not something that's part of my job, but I do it because it's what helps get those clients what they need. So I do ask and implore that you guys take these stories back and share them and let them know that we really do need this service. It would be detrimental to their health and their lives to not have this show van on the island. Thank you.
Thank you.
Thank you. Next speaker is Maria Guadalupe Ramos, community health worker. And after that is Heather Butts.
Good evening, everybody. My name is Maria Ramos. I'm here to support my community immigrant people. I'm here like mom, like daughter, like friend. And it's not fair that the showman is no anymore. I made a speech, but I know that everybody say a little bit that I have in my speech, but I think I'm here for my immigrant community, so I need to them know that I'm here for them, so I'm do in Spanish. Sorry. Estoy aquí para apoyar a mi comunidad inmigrante que habla español, que no entiende el inglés y que necesitamos del apoyo del show band, porque ellos están alrededor de Staten Island. Muchos de ellos no saben cómo llegar. Entonces estoy por ellos para apoyarlos. Estoy, gracias a Project Hospitality y en el Centro del Inmigrante, estoy aquí para alzar la voz por mi comunidad. Estoy aquí para que ellos sepan que no están solos, que estamos todos aquí apoyándolos. Y mi gran petición es que no nos quiten el show band. And sign. Can you read aloud, please? Las vidas de Staten Island importan. Thank you.
Gracias.
Thank you. The next speaker is Heather Butts, Executive Director of Health for Youths, and after that is Helen Settles.
I am reading this statement on behalf of Heather Butts. Heather is the co-founder of the nonprofit Health for Youths, as well as an associate professor at Columbia University Mailman School of Public Health. The Street Health Outreach and Wellness Show Van is a critical aspect of health and wellness for public health around the city. From COVID-19 tests and other vaccines to harm reduction and basic health needs, it makes sure that those who have no other options for this kind of critical life-saving care receive this outreach. The ban specifically serves individuals who do not qualify for public health insurance such as Medicaid and do not have the means to pay for private insurance. Far from eliminating the show van on Staten Island, this critical care should be expanded. All the 4 other boroughs in New York City have full-time show vans. Currently, the show van allows for individuals to be seen by a nurse practitioner or physician's assistant, EMG, and addiction or mental health counselors. Screening for illnesses provided, including drug abuse or mental health issues. Referrals made for follow at Gotham Vanderbilt. Please note that Staten Island is the only borough that does not have its own dedicated public hospital, so any and all resources that come to Staten Island to support the effort of health and well-being are necessary and must be commended. Although Staten Islanders have to travel off-island for certain critical services, as mentioned, Staten Island is the only borough without a full H&H services. Please restore the show van back into the budget for fiscal year 25. Further, please expand the services of the show van to other parts of Staten Island, such as Park Hill, Stapleton, West Brighton, and New Brighton. This van could also be utilized for mobile health to other communities in need and expand the services that are not served on Staten Island because there is no public hospital on the island. The show van is vital to Staten Island and needs to be restored into the city budget.
Thank you.
Thank you. Next speaker is Helen Settles, a retired teacher. Not here. Okay. Next speaker is Reverend Judy Brown, pastor with African Refuge. No, okay. Michelle Molina, executive director of El Centro del Inmigrante NYC. And after that is Dino Villegas.
Afternoon, everybody. Thank you so much for this opportunity. My name is Michelle Molina, Executive Director of El Centro del Inmigrante and El Centro Community Job Center. I really want to thank you for this opportunity to speak on behalf of our community. And I'm trying not to be emotional after some of the speeches. I work almost in day in, day out with some of the people that are here. And we do struggle finding ways to help our community sometimes. We face difficult situations in which we are not really sure how to help them sometimes, and we consult with one another. But having the show van has been critical for many of these services, and I would like to emphasize tonight the critical importance of the show van and this program, which is providing essential health services to underserved populations in Staten Island. And I want to highlight El Centro's active role in supporting and facilitating the services and share the historical impact that has been established through health and hospitals. In 2022, the show van visited 12 times, and we were able to serve 287 clients. In 2023, the show van visited 15 times, and we were able to serve 268 clients. 2024, which was cut short, but we had 6 visits serving 102 clients. In total, I can say that 657 clients were served in 33 visits to the 260 Port Richmond Avenue alone, not including the multiple services that are provided to clients at each service, at each time. We have had cases where day laborers have been transported to ambulances to the hospital after being screened by the show van. And it's either been for one of our cases, which a gentleman, Jeronimo, he tested 538 on his glucose levels. And we also had another gentleman that was taken as an emergency to Rumsey Hospital because of his high levels of also on his glucose. There's an urgency for the funding restoration, and we understand this. The Chauvin's funding for Staten Island was cut to the budget due to budget reallocations, specifically from the subway outreach program. And unlike other boroughs, Staten Island no longer has access to this essential service. The Chauvin was routinely undersupplied, and I'm saddened to say this, in many occasions during the visits. So it was very important for me to approach the van and find out exactly how many vaccines we had each time, what kind of services we were going to be able to provide. And unfortunately, this was impacting the effectiveness and our ability to promote the program as well. I was not able to promote largely and widely as I wished to, so our numbers were affected by that as well. We consistently faced issues in obtaining tetanus shots for our day laborers. Despite repeated requests, we have a population which is in dire need of the tetanus shots. Our day laborers, they have to make a decision if they get hurt on the job, whether they continue to work or they go to the hospital. And I can guarantee that every time they will stay at the job because they do not know when they're going to work again. And this is a very difficult decision because they don't know when their next meal is going to happen, when they're going to be able to pay for their rent. And these decisions are crucial, and they will not stop work for these dire needs, these services. They're not going to stop. So to us, it's extremely important to provide these services at their door for them to know that they can approach us and that they have a trusting place and a friendly face, like many said, at the Chauvin. So the basic medical services that were mostly utilized were medical evaluations, wound care, vaccinations, influenza vaccines, COVID-19, flu shots, tetanus shots, blood pressure, and glucose screenings.
Your time's expired, so would you just conclude? Thank you.
Thank you so much for your time.
Thank you.
Thank you. Thank you very much. Thanks for your comments. Next speaker is Dino Villegas, manager at El Centro del Immigrante. And then after that, Zenobia Sisana Jenko.
Hi, good evening, everybody. My name is Dino Villegas. I'm representing El Centro del Migrante. The Chauvin is a crucial service bringing healthcare directly to where people live and work, such as the Port Richmond area. On Staten Island, we have many low-wage workers and immigrants who lack health insurance and cannot afford medical care. The Chauvin offers walk-in visits, providing essential medical advice and directing patients to service like the Gotham Center at Vanderbilt, which treats uninsured patients. The Chauvin is more than a clinic. It's a pathway to health and life-saving care. It helps immigrants who often fear that seeking public assistance will affect their status by offering accessible healthcare information and services. Staten Island, the only borough without a city hospital, has seen multiple clinic closures. We went from having a mobile clinic 5 days a week to the Chauvin for just 5 hours weekly, which is now set to end in June. Our growing immigrant community depends on the Chauvin to find affordable health care and support for issues like stress and anxiety. Losing the Chauvin and its services will be devastating. Please find a way to reinstate these life-saving services for our community. Thank you.
Thank you. Next speaker is Zenobia Sisana Jenko, community member for El Centro. Sorry, and after that is Father in Econway.
Muy buenas noches a todos.
Buenas-
Señor presidente Micheli,
Soy yo.
y todos presentes de la plenaria y también a todos los integrantes de aquí de la sala. Bueno, primeramente quiero agradecer a Dios por estar viva y estar aquí. Y en segundo lugar, quiero agradecer a ustedes de la plenaria que hicieron lo posible para esta audiencia. Muchas gracias por recibirnos en este momento. Como quisiera también decir que nosotros somos seres humanos. Despertamos cada día con un desafío en la vida, de trabajar, llevar pan a casa, seamos profesionales o no. Nuestro color no nos distingue. Blancos, negros, morenos, rojos, pero tenemos un solo color de sangre. ¿Qué color es? ¿Azul? ¿Negro?
Ojo.
Rojo. Este es nuestro objetivo. Y este color no nos distingue a nadie. Y es más, las enfermedades vienen día a día. No sabemos si mañana vamos a estar enfermos o tal vez vamos a morir. No sabemos si mañana podremos todavía estar sentados aquí hablando, defendiendo nuestros derechos o pidiendo apoyo. Lo que sí sabemos es que hoy podemos hacer la diferencia. Usted, yo y todos juntos aquí, para tener personas, una población mucho mejor que ayer y mañana será mucho mejor que hoy. Queridos hermanos, nosotros estamos aquí representando a la población inmigrante, como nuestros colegas Michelle y Dino ya hablaron. Estamos con un pedido. Queremos tocar vuestro corazón. Queremos llamar su atención hacia nuestra población inmigrante. No somos solo de un país, somos de todo el mundo. Personas ilegales que no tienen dónde ir cuando están enfermos, que tienen miedo de salir de la puerta a la calle porque piensan que serán arrestados. ¿Qué sociedad tenemos? Sociedad muy triste. ¿Y nuestra población crece así? No crece, porque necesitamos una población sana, que esté dispuesto a trabajar, y cuanto menos enfermedades tengamos, la población crece, todo va adelante. Y como profesionales de salud, nuestro deber es velar por ellos. De todas estas personas, las enfermedades no tienen preferencias. Todas estas enfermedades se pueden prevenir, se pueden estagnar, como se dice. Pero ¿a través de qué? Nuestros profesionales de salud, enfermeros, médicos, ellos nos pueden dar charlas, porque ellos estudiaron durante 5, 7, 10 años justamente para ayudarnos a nosotros. Entonces, por ejemplo, el uso del agua, tomar 8 vasos al día, esto puede ayudarnos. El uso del descanso, dormir de 7 a 8 horas por día o por noche. También el ejercicio físico está junto. Luz solar, el aire puro, nutrición adecuada, temperancia. Creer que también tenemos una esperanza, porque tenemos un Dios. Independientemente cuál sea, creemos en algo. Entonces, esta esperanza nos tiene que llevar adelante a que hoy nuestros hermanos inmigrantes en sus casas o en sus trabajos puedan saber que hay alguien representando por ellos. Y no somos solo nosotros, son ustedes también. Y muchas gracias por eso, porque a cada día nosotros nos recordaremos que ustedes nos dieron una esperanza a través de todo lo que ustedes hicieron. Gracias por estar presente aquí y por escucharnos. Y mañana nosotros continuaremos agradeciéndoles. Muchas gracias.
Gracias.
Gracias. Next speaker is Father Ekunwe from St. Mary's Episcopal Church, and after that is Benedict Snyder.
Good evening, everyone.
Good evening, Father.
My name is Father Sylvester Conway. I'm just going to speak out of a personal experience. I've been a priest for about 10 years now, and I've been on Staten Island for 2.5 years. And at St. Mary's, we serve food on first Saturday to, people that need food. And we have been serving people. Thank you. We serve about 350 families on the first Saturday of every month. And as I go around talking to them, there are people that come to me and say, we need transportation to get to New York City for some kind of testing, to access healthcare, which they cannot ordinarily do here. I don't think for us on Staten Island, the question is if we need a show van, is how we can expand the service of the show van. So I see myself every time when I'm going to go for house visitations to carry Narcan kit with me, because I've received training on that, with my Holy Communion kit, in case I run into someone that is overdosed. And we know what has been happening now on Staten Island for the past several months. So I applaud you. I want to really beg you that you bring this message to the city hall, so that they can at least not only retain the show van, but to expand the services. Thank you.
Thank you, Father.
Thank you. Thanks for your comments. The next speaker and the last speaker this evening is Benedict Snyder, President of the Staten Island Liberian Community.
Good afternoon, everyone. Well spoken well to the cause of the people of Staten Island. And it is a sad story that every time we come up to speak, we say we are the forgotten borough. At this time, I hope we're not going to be the forgotten borough, but you'll look our way. Taking away the service of the show van from our community hurts us. So I know when I came to this country, I've seen people walk to the van, get services, and those are people who were less privileged. So taking it away from them will only mean that there are many people who don't know of these services. So we hope and appeal to your conscience that you will take the message back, pass it on to the powers, and let them consider that they are also serving humanity. So the inclusion of the show van on the budget will immensely help our community, our population. So I want to appeal to you again. Thank you for all you do. As you know, the population of Staten Island is growing. So there's a need to have the show van within our. Thank you again. Thank you very much.
Thank you.
Thank you. Well, that concludes our program for tonight. Thank you so much for being here, and please get home safely. Thank you.
Thank you, everyone.
Thank you.